Left, yeah, we right.
Not we.
I ain't doing it.
I said, look, I was doing on the left right here.
His left, not your left.
How you so
You
doing
on
when
the
you
wrong side.
No.
You're on your left.
We did that already.
He come back alive, man.
Uh-huh.
I would save your life doing this.
Uh-huh. Just call 911.
Problem solving. Problems.
All right. Have a seat, because y'all going to be standing up in just a minute. All right.
Communication.
So we talked about what we needed for communication. You need to communicate with your team, bystanders. You can bring your management over if you want. And if possible, the victim. Communication includes verbal and nonverbal messages. So the goal of proper communication is to eliminate misunderstanding. Closed loop communication is one technique used to prevent misunderstanding. So that's why I tell y'all need to make sure y'all are calm, because when you get not calm is when things
Closed
happen.
loop communication.
All right, so closed loop involves three basic steps. Send a message. The sender of the message tells the message to the receiver. Provide feedback. The receiver provides feedback that the message was properly understood by repeating the message back to the sender. If the receiver does not provide feedback, the sender should ask for it. Acknowledge task is done by the receiver. If the message was to do a task, the receiver should acknowledge when the task is started, and more importantly, when the task is completed. Overall, it's important in an emergency to always communicate in a clear, organized, calm, and respectful manner. Speaking over others should also be avoided unless absolutely necessary.
Teamwork.
Then you got teamwork. It involves a group of people working together to achieve a common goal. It's important that every member of the team has well-defined roles and responsibilities and that they understand them. This allows the team to work in a coordinated effort to achieve the goal. During a cardiac arrest, healthcare providers will usually work as part of a team with the goal of saving a life by providing BLS. All right, so we're going to look at one-person adult rescue. I gave y'all a flow chart. One of them should say 1 and 2 person adult, because it's really the same. Just you have 2 people. So we're going to look at that. Then we're going to look at the actual American Heart video and let y'all practice while watching.
What you'll learn.
All right, so this is the thing that I gave y'all. This is the little BLS flow chart. So like I told y'all, the first thing you're gonna do is verify the scene. So you're gonna
1.
make sure the
Verify the scene is safe.
You're gonna verify the
2.
scene is
Check
safe.
for responsiveness.
And then, so what that means is you're looking around, making sure you're not walking into danger, because you don't want to be a victim just like whoever you're trying to help. So if it's like a shooting, a fire, water everywhere, like you might drown or something, you gotta make sure that you are able to help your patient. You're gonna check for responsiveness. So what you're gonna do when you check for responsiveness, you're gonna tap and shout, "Are you okay? Are you okay?" So you just tap them on the shoulders, "Are you okay? Are you okay?" And then after you do that, you're gonna check for a pulse. Like we said, you're gonna check the carotid artery, which is in the neck. So you're gonna check the carotid artery. You're gonna take 2 fingers, and then you'll feel here, right, on either side, whatever side you're closest to. While you're feeling, you're looking at the chest to see if there's any movement. So at the same time you're feeling for a pulse, you're looking at the chest to see if you see any chest rise. This should take no longer than 10 seconds. Anything longer than that, no. So once you figure out that there's no breathing, meaning their chest not rising, no pulse, means no circulation, then you're going to perform high quality CPR. But you're gonna, between there, you're going to call for help, call for AED. Because the quicker you get the AED in the picture, the quicker the chances will be. So you'll do that. You're gonna do high quality CPR, starting with chest compressions. Anybody know how many compressions you do? 30 compressions, and how many breaths? Nope. Nope. 20 some breaths? 10. Nope. You just yelling out stuff. 30 compressions, 2 breaths. So you'll compress 30 times, then you'll give 2 breaths. 30 times, 2 breaths, like that. That's back and forth like that. You're going to attempt defibrillation. The important thing to remember about the AED is that you have to turn it on. If you don't turn it on, it's not going to tell you what to do. So we'll look at the one I got here. I keep forgetting to bring. I got one at home. Keep forgetting to bring it back. And then you'll assist to recovery position. So we'll go through these steps here, and then I'm gonna let y'all watch the video and practice.
Personal protection.
Of course, we know what PPE is. You should use personal protective equipment. What that is specialized clothing and equipment that prevents direct contact with potentially infectious materials. It can include gloves, breathing barriers, shirts, pants, face shields, and protective eyewear. And I think did I show y'all the little mask thing last week? The little clear thing. Yeah. So that's like just a face shield that'll protect. But I say if you're out somewhere, just do chest compression. Don't even worry about the breaths until like EMS or somebody arrives.
Step 1.
All right. So we know we're going to verify the scene. So you're going to survey the scene around the victim, verify that it's safe to approach. Is there evidence of a fire or a gas leak? Is anyone holding a weapon? Are the victim's hands concealed? If the scene doesn't seem safe to approach, back off and activate the emergency response system. So you'll just back up and you'll call 911. Don't take any action that may lead to you becoming a victim. Also, observe the victim, which includes looking for life-threatening bleeding. Life-threatening bleeding should be treated immediately. Look for clues as to what may have caused the emergency. Ask bystanders what happened. Because somebody probably going to be standing around.
Step 2. Check for.
Then you're going to check for responsiveness. You're going to tap the victim's shoulder and ask loudly, "Are you okay?" So you're going to tap and shout. If the victim does not respond and you're alone, shout for nearby help. So you can say, "Are you okay?" Lack of oxygen to the brain can cause movements that make a victim appear to be conscious, such as a quick raising of arms. Do not mistake these movements for a response. So they can have a movement, but it not necessarily mean that they're conscious. So you'll activate the emergency response system appropriate to the setting. For example, in a health facility, you might need to activate a specific code. In a public setting, you might need to call 911. So if you're by yourself, everybody got their cell phone, just whip it out, put it on speaker, dial 911, and you can proceed to do what you need to do. If someone answers a call for help, send that person to get the AED. Otherwise, if you're alone, leave the patient and retrieve an AED. So you still need the AED even if you're by yourself, but it's helpful if you got 2 people.
Step 3.
All right, so then you're gonna position simultaneously check pulse and breathing. So that means you're gonna check for the pulse, the carotid artery, and also look for signs of breath in the chest. Make sure the victim is in the supine or face up position. So supine is laying like this on their spine. Supine is on the spine, face up. If the victim needs to be rolled, take care not to worsen any suspected injury. If the patient is they're on something soft, in order to do effective CPR, they need to be on something hard. So a floor, the CPR bed, the beds in the hospital, they have a CPR mode on them, and they'll flatten real quick, and then the mattress will harden because you have to be like when you're doing compression, you need something that's gonna be hard behind them. Give the victim a chance to breathe by opening their airway using the head tilt, chin lift. So it's just like it sounds. It's head tilt, chin lift. And when you do that, when you get ready to give them breath, the air is going to go down to the lungs the right way. It's going to move the tongue out of the way. The head should be slightly past neutral with a slight reflex in the neck, avoiding hypertension on the neck. So you don't want to do the neck all the way back here. You just want to do a nice little head tilt, chin lift to open their airway. So if they have any kind of spinal trauma or you think...
Please excuse this announcement. If you have not taken your students to lunch, please do so at this time.
Oh, it sounds like she's in a hole all the time. Alright, if spinal trauma is suspected, use the jaw thrust technique.
2. Check for.
Alright, so you're going to check for the carotid artery pulse. So you can use 2 or 3 fingers to locate the trachea on the side closest to you. So whatever side you're on, that's the side that you should check. So you're going to slide these fingers down in between the trachea and the muscle at the side of the neck to feel for a carotid pulse. While you do that, like I said, you're going to check for normal breathing. Look at the chest for a consistent rise and fall. During normal breathing, the chest will rise and fall about 2 times every 10 seconds. The victim may experience agonal respiration, which is characterized by snorting or groans, strange vocalizations, and jaw and hand movement. Agonal respiration is not normal. They're breathing agonally. that means they're probably going to start breathing soon. So don't consider that to be normal. I'll find a video of somebody breathing agonally so y'all can know the difference. Feel for a pulse and check for normal breathing for at least 5 seconds, but no longer than 10 seconds.
Determine next action.
Alright, so the pulse and breathing checks are used to determine the next course of action. If the victim is breathing normally and has a definite pulse, do not begin CPR. So if they have a pulse, you don't want to do chest compressions. Place the victim in the recovery position and monitor. You'll reevaluate their pulse and breathing every 2 minutes, so you'll keep checking on them. If the victim has a definite pulse but no normal breathing, you'll have to do rescue breaths. So you'll give a 1 breath every 6 seconds or about 10 breaths per minute. Each breath should last about 1 second. A way to remember that is if you just have to do rescue breathing, every time you take a breath, you'll give them a breath. That's just a good way to remember it. If an opioid overdose is suspected, you'll give naloxone according to local protocol. Naloxone is a drug that can reverse the effects of the opioid. Because when people overdose, they're messing with their respiratory system. So they could take medicine and it'll knock out their respiratory drive, so they won't have that autonomic response to breathe. So that's what happens when people are OD. So once you start breathing, everything else starts slowing down, and then like your brain's not getting oxygen, your heart's not beating. So if the victim lacks a pulse and normal breathing, the victim is in cardiac arrest, so you're gonna begin CPR. After rescue, verify that the scene is safe and that an adult victim is not responsive. What is the next step? Right, you're gonna activate the emergency response system. If the adult victim has a pulse but is not breathing normally, what should be done? Give rescue breath. Right. Because you never want to give compressions on somebody that has a pulse.
Step 4.
Alright, so high quality CPR. At this point, the emergency response system is activated and an AED is being retrieved. Perform high quality adult CPR until an AED is available. Generally, the victim should not be moved. However, if their current position or location does not allow for effective CPR, move them as needed. Quickly move bulky clothes out of the way. If a person's clothes are difficult to remove, you can still provide compressions over clothing. If an AED becomes available, remove all clothing that covers the chest. AED pads must not be placed over any clothing. So you're gonna need to get to their chest, especially if you're using an AED.
3. Perform chest.
Alright, so chest compressions. Perform chest compressions and rescue breaths at a ratio of 30 compressions to 2 breaths or 30 to 2. Do not stop chest compressions for longer than 10 seconds to give rescue breaths. So do your 30 compressions, then you'll give your 2 breaths. Your 2 breaths should not take longer than 10 seconds. Continue CPR until one of the following occurs. An AED becomes available. The victim shows signs of ROSC. Care is transferred to an advanced life support team. You're unable to continue because of exhaustion or the scene becomes unsafe. A valid document stating that resuscitation should be stopped is presented. So that means they have a DNR order. Sometimes that might have happened in the hospital when somebody come from the nursing home and they just went ahead and brought them. We didn't have any documentation on them, so we will have to go ahead and start CPR until like somebody brought the stuff that said it was a DNR. So that's what that means. And DNR means do not resuscitate. Which of the following is the correct ratio for chest compression and rescue breaths during adult CPR? 30 compressions and 2 breaths.
Step 5.
Alright, so you're going to attempt defibrillation. When an AED is available, it should be used immediately. You're going to follow all the prompts provided by the AED. The general procedure is turn on the AED, attach the AED electrical pads, check for a shockable rhythm. So this is what the AED is doing. It's checking for a shockable rhythm. When we talked about VTAC and VFib, those are shockable rhythms. If the heart rhythm is shockable, deliver 1 shock. So it will tell you if it's a shockable rhythm because it'll prompt you to give a shock. After delivering a shock, or if the rhythm is not shockable, you're going to immediately start CPR. It'll tell you that too. After about 2 minutes, the AED will request to check the rhythm again. When the AED is checking the heart's rhythm, or delivering a shock, the rescuer should stop working on the victim and stand clear. When should CPR be stopped? Right. So when EMS come and they take over, when an AED becomes available, when you have return of spontaneous circulation, that's what RAW stands for. Return of spontaneous circulation. That means you don't have to, when they get a pulse back.
Step 6.
All right. Assist to recovery position. If the victim begins to show signs of ROS, such as coughing, normal breathing, or movement, assist the victim to the recovery position. Always follow local protocols, but generally use the following procedure. And then, do y'all know what the recovery position looks like? Y'all seen it? I'm gonna have to find a picture. You're gonna place the arm that is close to you, straight out from the body. You're gonna bend the other arm across your chest with the back of the hand against the opposite cheek. Bend the victim's knee that is farthest from you. Pull the knee towards you and roll the victim to the side. Be sure to protect the victim's head with your hand by keeping the head in line with the spine. You're gonna tilt the head slightly upward on the back of the victim's hand. This will keep the airway open. I'll find a picture of it. All right, one person BLS procedure. What's step 1? You're gonna verify the scene is safe. Okay. Check for responsiveness. That's tap and shout. Are you okay? You're gonna check your pulse and breathe at the same time. High quality CPR. Defibrillation. And then assist to recovery position.
Lesson summary. In this
Now, I'll put the video. Huh? What? You crawled on it. Oh. Oh. Internet or whatever.
Heart disease is the #1 cause of death in both men and women globally and claims more lives than all forms of cancer combined. Cardiac arrest may be caused by almost any known heart condition and is often fatal if appropriate steps aren't taken immediately. Cardiac arrest does not discriminate. It can affect all ages, genders, nationalities, and races. This is why early recognition and immediate cardiopulmonary resuscitation, or CPR, are crucial for survival from cardiac arrest. Healthcare providers are the backbone of the systems of care in both the community and medical facilities. Advanced rescue measures cannot be successful on their own without solid basic life support, or BLS. This training will guide you through the key practices of high-quality BLS.
Products are shown for demonstration purposes only. The AHA does not endorse or recommend any specific manufacturer or product. In order to show skills clearly, the healthcare providers in this video do not always use recommended personal protective equipment, such as gloves. The AHA's mission of saving lives is a global initiative. The AHA recognizes that heart disease is the #1 killer of both women and men. However, most skills in this video will be demonstrated on male victims to respect global awareness and cultural sensitivity. On any given day and at any time, you can encounter a victim of cardiac arrest because about every 90 seconds, a person dies of sudden cardiac arrest. But with the training you receive today, your actions can give a victim the best chance of survival.
Sudden cardiac arrest occurs without warning or within just a few minutes after symptoms appear. The term heart attack is often mistakenly used to describe cardiac arrest. Although a heart attack may cause cardiac arrest and sudden death, they are different conditions. But it's important to call emergency services for both. There is more information on the differences between heart attack and cardiac arrest in your provider manual.
First, let's talk about the 2 adult chains of survival. One is for out-of-hospital cardiac arrest, and one is for in-hospital cardiac arrest. The 2 chains have 6 links, but the links differ slightly. Both chains include activation of the emergency response system, high-quality CPR, early defibrillation, post-cardiac arrest care, which may be provided in the cath lab or the intensive care unit, and recovery.
For the out-of-hospital chain, the difference is the 4th link, which focuses on advanced resuscitation. In this link, a multi-rescuer team arrives and takes over CPR and may perform additional advanced interventions. For the in-hospital chain, the difference is the 1st link. It focuses on early recognition and prevention of cardiac arrest with patient monitoring and assessment, and, if necessary, rapid response by the medical emergency team when a patient's condition starts to deteriorate.
Now, let's review the links in the out-of-hospital chain of survival as they could happen in a real-life resuscitation event. It's a normal day at the airport. A woman notices that her husband is not looking well. When he collapses, she immediately calls for help, and a security guard rushes over. The guard gets no response and sees no sign of breathing, so he directs a coworker to activate the emergency response system. The out-of-hospital chain of survival begins right here, with the guard's immediate recognition of possible cardiac arrest and activation of the emergency response system. A rescuer must recognize that someone is in cardiac arrest. This person will have signs such as unresponsiveness and lack of normal breathing. After recognition, the rescuer should ensure that the emergency response system has been activated and begin high-quality CPR. Effective bystander CPR provided immediately after cardiac arrest can double or even triple someone's chance of survival. Bystanders who aren't trained in CPR are encouraged to provide compression-only CPR, also called hands-only CPR. When an untrained bystander sees an adult collapse suddenly, there are 2 simple steps to follow. Call 911 and push hard and fast in the center of the chest. Dispatchers or telecommunicators may provide further instructions, including step-by-step coaching on how to perform CPR until trained help arrives.
Some rescuers might find it necessary to provide compression-only CPR until a barrier device is available. The guard begins chest compressions without delay. A second guard returns with an AED. This introduces the next link in the chain of survival. The AED, or Automated External Defibrillator, is a lightweight portable device that can identify an abnormal heart rhythm that needs a shock. The AED can then deliver a shock that can convert a rhythm back to normal.
Most sudden cardiac arrests are triggered by abnormal heart rhythms called arrhythmias. A common and treatable arrhythmia causing cardiac arrest is ventricular fibrillation, or VF. With VF, the heart's electrical impulses suddenly become chaotic and ineffective. Blood flow to the brain and other vital organs stops abruptly, and the person loses consciousness. Death usually follows unless a normal heart rhythm and pulse are restored within minutes. The AED uses voice prompts, lights, and on-screen messages to tell the rescuer the steps to take. AEDs are simple to operate, allowing lay rescuers and healthcare providers to attempt defibrillation safely.
As the emergency medical services, or EMS providers, arrive and take over care, they provide advanced life support, extending the chain to give the person the best chance of survival. Advanced life support can occur in any setting and provides more advanced treatment.
Once the return of spontaneous circulation, or ROSC, is achieved, EMS transports the person for post-cardiac arrest care. Post-cardiac arrest care after ROSC focuses on preventing the return of cardiac arrest and improving long-term survival. Recovery from cardiac arrest continues long after hospital discharge and includes physical, emotional, and family support. These 6 links show the most important actions needed to treat cardiac arrest.
BLS is the foundation for saving lives after a cardiac arrest. In this course, you'll learn the skills of high-quality CPR for people of all ages and practice delivery of these skills, both as a single rescuer and as a member of a multi-rescuer team. Now, let's go back and review a rescue, focusing on the steps of BLS as they happen.
There are several steps of BLS that you'll need to perform when you suspect that a person is in cardiac arrest. First, scan the scene to assess safety. Then, check to see if the person is responsive by tapping and shouting. If they do not respond, activate the emergency response system and get an AED, or send someone to activate the emergency response system. Next, check for breathing by watching the chest for rise and fall.
Abnormal breaths are common in the first minutes of a cardiac arrest. These abnormal breaths are called agonal gasps and should not be confused with normal breathing. Rescuers can sometimes mistake agonal breathing for normal breathing and fail to recognize cardiac arrest and initiate CPR. Seizure-like activity can also sometimes delay the recognition of cardiac arrest.
If the person has no signs of responsiveness, the emergency response system has been activated with an AED on the way, and there are no signs of breathing or a pulse, then immediately begin CPR starting with chest compressions. The delivery of rapid, strong compressions is a priority, but be sure to deliver ventilation as soon as the pocket mask or bag mask device arrives. Once the AED arrives, it is important to use it immediately. We will go over proper AED use later in the course.
You never know what situation you'll face or what resources will be accessible. It's important to have the knowledge and a framework to provide high-quality, life-saving CPR regardless of the conditions and circumstances.
Now we will focus on the individual skills that rescuers perform. It is most effective to perform CPR as a team, but to be an effective team member, you'll need the individual skills of CPR. So we'll start there.
As a healthcare provider, your first step is to assess the surroundings for safety. Then, tap and shout to see if the person responds. If not, you should shout for nearby help or activate the emergency response system in your workplace. Check for breathing by scanning the person's chest, looking for chest rise. Check for a carotid pulse. The technique of feeling for the carotid pulse is usually easier to perform on the side closest to you. Use 2 or 3 fingers to locate the person's trachea, and then slide your fingers into the groove just to one side of the trachea.
You can scan for breathing and check for a pulse simultaneously to minimize time before compressions. The check for breathing and pulse should take at least 5, but no more than 10 seconds. If you observe no breathing, abnormal breathing, or only gasping, and you do not feel a pulse, ensure that help is on the way and start chest compressions immediately.
Before you start chest compressions, make sure the person is lying face up on a firm, flat surface. If you need to remove clothing to expose the person's chest, do it quickly. You need to work with a bare chest because later you'll attach the AED pads to bare skin.
By starting compressions, you are initiating the CAB sequence, or compressions, airway, and breathing sequence. In the first few minutes of a cardiac arrest, there is still oxygen in the bloodstream. Starting CPR with chest compressions can pump that oxygenated blood to the brain and heart. After you give compressions, open the person's airway and deliver breaths. It's important to minimize interruptions in chest compressions to 10 seconds or less. Each time you stop compressions, the blood flow to the heart and brain decreases significantly. When you resume compressions, it takes several compressions to increase blood flow to the heart and brain back to the same levels. So any interruption in chest compressions can result in low blood flow and minimize the chance of ROSC.
To begin, place the heel of one hand on the center of your mannequin's bare chest, over the lower half of the breastbone. Place the heel of your other hand on top of the first. Make sure that your shoulders are directly over your hands with your elbows straight. And when we start, remember to push straight down on the breastbone to get adequate depth. When you push, push hard and fast. There is some evidence that compressing too deep can increase injuries from CPR. However, a larger problem is that most providers don't compress deep enough. So focus on making sure your compressions are deep enough. Compress at a rate between 100 to 120 per minute while counting out loud, making sure the compressions are at least 2 inches or at least 5 centimeters deep, and allowing the chest to recoil after each compression. We recommend using a feedback device that provides real-time corrective feedback on CPR quality regarding rate, depth, and chest recoil, not just when performing CPR in practice, but also in your workplace. We'll talk more about feedback devices throughout the course, and you will complete some practice and testing with them later.
You can follow along with what's on the screen as you perform compressions yourself. You'll perform 3 sets of 30 compressions after you assess the scene. We'll pause here while everyone gets into position.
All right, let's go. Come on, get up. Let's go.
What you want to do?
Chest compressions, let's go.
I think it's being bad.
Yeah, because you sleep.
I want to
On any given day and at any time, you can encounter a victim of cardiac arrest because about every 90 seconds, a person dies of sudden cardiac arrest.
I did have my heel right.
All right, so
Change to you over to the camera.
y'all gonna have to do the whole thing. All right, so your patient needs to be turned this way because you're gonna be on the side now.
So they need
Her
to be.
patient dead because she's sick.
I want to get in the camera so I can show you.
Turn it. Okay. Yeah. Let me get you on.
That way. Yeah. You got you please get the mask more. I do. Yeah, it's a little bit there.
It's a little wobbly.
I want to too.
All right, so you're gonna go through the thing. Y'all gonna practice while watching. That means y'all gonna go with the video. So when you're doing chest compressions, okay, watch me real quick. When you're doing chest compressions, remember this is your sternum, right? Your breastbone. You gonna take, and it don't matter whatever y'all dominant hand is. I'll put my right hand down first. You should feel like the lower half of the sternum. Put your other hand on top, and you're gonna make sure that your shoulders are directly over your hand. And your arms don't need to be bent, they're gonna have to be straight. And you just gonna put it straight down. You should hear a clicking sound. That means you're right. You hear clicking. You don't hear clicking you in the stomach, or you know you're supposed to be Y'all feel it? Nope.
Why you all in the middle kind of? That's the stomach though.
tell. Make sure how to roll the tail. Okay, I just want to Nope. Alright, so y'all gonna go with the video, y'all ready? I think they're gonna assess the scene and all that first, if I remember correctly.
It's fair right now. Maybe it's our stomach because we got food.
What?
It kind of feels like the right.
Alright, so
Okay, let's begin. In 3, 2, 1.
looking around, you're assessing the scene.
Hey, are you okay? Are you okay? Help, someone help.
Check the pulse, check the breathing. How y'all looking? Alright.
Activate the emergency response and get an AED.
Now you get to the chest and ready. Go.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Alright, this is where you do your 2 breaths. So we're pausing right here. Alright, you're ready.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
This is where we'll give our 2 breaths. Alright, get ready.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
We outside?
You know that hurts my wrist.
Y'all tired.
My arm.
Y'all wanna go again?
No.
Okay.
Yes.
What's
Look at my wrist hurt.
Y'all ain't did
You
nothing
see
yet. Y'all ain't did nothing yet. Y'all don't wanna do it again?
Yes, let's do it again.
Okay, one more time.
Come on, we gotta bring these people back to life.
Yes.
Okay, let's begin. In 3, 2, 1.
Alright, next
Now, check the
I'm
scene.
trying to make sure I got it.
Hey, are you okay? Are you okay? Help, someone help.
Help.
Check for a pulse, looking for breathing. You're looking at the chest. Alright.
Activate the emergency response and get an AED.
Alright, ready?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Right here, you'll get 2 breaths.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Alright, give it 2 breaths.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Alright, okay.
My patient said breathing.
Alright, y'all have a seat. Y'all have a seat.
My wrist hurt.
Just imagine doing that for like an hour.
I'm doing it on a real person.
On a real person. On a real person. And you sweating and trying to get them back. A water break? Y'all get no water break. Alright, so this is gonna show y'all about the pocket mask.
So now, let's go through the use of pocket masks, and then we'll practice one rescuer's skills with compressions and breaths. When you're working, you'll likely have access to a bag mask device. However, because a cardiac arrest can happen anywhere at any time, it's important to be comfortable and effective with a pocket mask. A bag mask device might not be too far away, but when minutes and seconds matter, The time saved by being proficient with a pocket mask is invaluable. We'll use a pocket mask for the one rescuer activity in our training today.
When the guard finishes a cycle of compressions, he quickly places the mask with the one-way valve on the person's face. He delivers 2 breaths and returns to giving compressions immediately to minimize interruptions in chest compressions to less than 10 seconds.
Now let's examine the technique. Place the mask on the person's face, using the bridge of the nose as a guide for correct positioning. Seal the mask against the face by placing the index finger and thumb of your hand that's closest to the top of the person's head along the edge of the mask. Now, place the thumb of your other hand along the lower edge of the mask. Then, place the fingers of that hand under the bony part of the lower jaw near the chin, taking care to avoid the soft tissue under the chin. After that, open the airway by using a head tilt chin lift. By lifting the jaw to bring the chin forward, you'll lift the person's tongue away from the back of the throat, relieving a possible airway obstruction. Press the mask down while lifting the jaw to hold the mask tightly against the face, and give 2 breaths while watching for slight chest rise. Actually seeing the chest rise with each breath is the best way to ensure that your breaths are effective. Breaths should be delivered over 1 second each, with just enough force to produce visible chest rise. Avoid excessive ventilation and pause about 1 second between each breath.
In this practice session, be sure to hold the mask firmly against the face while lifting the jaw. Also, watch for the chest to rise as you deliver each breath over 1 second. We'll pause here for you to get into position with the mannequins to practice the technique of opening the airway and giving breaths by using your pocket mask with a one-way valve. We'll practice 5 sets of 2 breaths along with the video.
All right, we don't have a pocket mask here, but I'm gonna show you what they're talking about. So, a pocket mask kind of looks like this. This is not a pocket mask. This goes on here. But a pocket mask looks like this, and it has a one-way. What happened to the phone? It's shut down. It has like a little valve on here, so when you're giving breaths, that you don't rebreathe the air, right? So what they're talking about when you're doing this, if you were to have a pocket mask, this rounded part at the top is what goes on the nose, and then this part here, it goes under the chin. So it'll fit like that. What you're doing with your fingers, I don't know if they said the EC, just like talking about the EC technique, no? Okay. All right, so these 2 fingers here looks like a C, these 3 fingers look like an E. And you will do your head tilt chin lift, so that's when you give it air. You do your head tilt chin lift, you do the CE technique. These 3 fingers gonna open the jaw because you want to make sure that you have a tight seal, because if you're giving breaths, you don't want any air to come out. You want all the air to go into the lungs. And you also gonna do a head tilt chin lift so that the air goes down. But that's if you're doing, mouth to mouth with a pocket mask. They have pocket masks. I showed y'all the little keychain one that I have. That I use. Well, I don't use it, but I just carry it around. But we use that. Now these mannequins do breathe, or the lungs does go up. Huh? Oh. But if you get a good seal, I might get one.
Teacher student excuse interruption.
And you'll see him breathing.
The time is now 12:58. The bell is going to ring in 8 minutes.
But this is just because I'm a respiratory therapist and I have many years of practice.
Registration is going to be
but you'll do your head tilt chin lift.
Wednesday,
make sure you got a good seal, and
p.m.
then you'll just
It's imperative that you come to the school with your parents. Do not stay at school for an extended period of time without your mother and or father. The goal is to go home, get with your parents.
All right, Wednesday we'll start with
the purpose of your parents coming because they have to sign documentation. Remember, students, that night school is going to give you the opportunity to get your right grade in or graduate with your cohort, meaning graduate on time. So, high school is going to be an outstanding program. It's going to be something.
I guess.
All
I'm gonna go to